The conference is about misinformation and disinformation in global health. And I was wondering why is it now important more than ever to um, talk about it and know more about it.
Sure. Well, first of all, I think that, we're awash in various forms of mis and disinformation, given changes in media, right? There are far many more media outlets. There's fragmentation of audiences. There's the rise of new sources of information that people trust, that might have dubious source of expertise, sometimes motivations that might be about gaining money, for instance, instead of securing public health.
Mm-hmm.
So I think the challenges of this particular moment in time, given changes in media structures, given changes in what people trust and how they consume media, make this a particularly hard problem in 2024, 25.
So, and what are the consequences for the healthcare when people read something on the internet or see something from an influencer?
Well, I think the consequences are potentially really great. As we know during COVID, for instance, disinformation in some cases where people who had political motivations undermined public health measures designed to protect the public, which resulted in death. I think on a more mundane basis, it means people putting themselves and others at risk needlessly,
Mm-hmm.
because they route around the public health institutions whose job it is to protect public health. Um, I think there's all sorts of legitimate debates we can have in democracies about risk, acceptable levels of risk, trade-offs. How do we protect the most vulnerable? The thing that I find particularly disturbing are people who, for political or economic gain, for instance, might undermine what public health agencies or democratically elected representatives might say we should do as a public to balance the needs of various communities that exist within societies.
Yeah. So, do you think the primary motivation behind the spread of health information is political or more? It depends on what kind of platform it is, but
Well, I think it depends on a lot of different things, right? So, as we saw in the United States, the case that I'm most familiar with, um, let's say Republican opposition to masking, and then ultimately opposition to vaccines in some quarters was 100% political. They initially wanted to downplay the consequences of the pandemic, in order to not make it look like it was hurting the Republican president in office. Then it became yoked to, I think, a bigger set of ideological questions over what's the appropriate role of the state in, telling people what to do in the context of public health, whether that was masking or whether that was vaccines. I mean, those are political fights that we have now. A path towards undermining directives of public health agencies was to question the science itself, right? Or to create doubt as to what the science said. And I think that was very much a strategy that we saw on display here. And the consequence of that is corroding public trust in public health agencies and public health officials for political gain. We've seen in other contexts that mis and disinformation can be motivated by economic profit, right? So
Mhm.
all the people online who sell dubious remedies to various human ailments, who promote things that don't have scientific backing before them on the false promise that they can cure COVID or they can make you stronger, they can make you smarter, whatever those things might be. I mean, those tend to be motivated by economics. At worst, they can make you sick because they're not proven. At best, they have no effect whatsoever. But I think in the long run, what it does is to sort of say, people don't need to trust the scientific institutions that are tasked with evaluating these sorts of claims, that they can trust whoever's peddling this snake oil. And that sort of corrodes, again, public trust in those institutions that are tasked with upholding the public interest and serving the public interest in a way that's not motivated by politics or profit.
Mm-hmm. And social media and online platforms, I think they help spread false health information or disinformation. But do you think there is something that the platforms can do so it will stop, or they will teach the users how to choose which they believe or not believe?
Well, I think platforms certainly can do more, right? And I think so. A core tension here is the sort of internationally recognized right in many democracies around the world and enshrined in the UN Declaration of Human Rights is freedom of expression, right?
Mm-hmm.
And on one level, platforms want to allow for the maximum amount of expression, in part because it's sort of a human good and a human right that people are able to express themselves. The challenge is that a lot of that expression takes place by bad faith actors who are seeking political or economic gain by manipulating the public in various ways. And where do you draw that line? I think platforms have tried to sort of say things that are likely to cause clear harm to public health should be out of bounds.
Yeah.
And where they've drawn those lines over time have sort of shifted. They had more of a strong approach, I would say, during COVID when the consequences of some of these things were particularly clear. Since that time, they've kind of rolled back and gone the opposite direction because there was political blowback from the right in various countries around the world
Mm-hmm.
to platforms being censorious in some way of right movements in particular, and some such as anti-vaccine advocates that cross the ideological spectrum and don't fit sort of neatly in those boxes. My own view on this is that platforms should clearly determine what speech they respect
Mm-hmm.
and where they're going to draw those lines themselves. I mean, to me, it's not a good business decision to run a platform where people might be getting sick using your product, right? So if I were Meta, or I were Blue Sky, or if I were Google, what I would say is I want to create a safe product that has some clearly established lines around what sorts of speech that I'm going to respect, because there is the likelihood certain things might cause harm. And if that means valuing a public right of expression, a public right to health and happiness over any one individual's right to expression, I'm going to be comfortable drawing that line. I think platforms really should take it more on themselves to design responsible products that cater to the interests, the public interest of those people that are using those platforms. Now, I will say I don't think government should dictate these things. I think companies should take it on themselves, because I think governments dictating these things, given that they control the state, can run us into some very dangerous territory.
Mm-hmm.
Now, governments look very different in the democratic
Yeah.
West, but I wouldn't want the Trump administration, for instance, or Orban's administration in Hungary dictating the platforms what speech they have to respect. I'd feel much more comfortable a company drawing those lines, because they have stakeholders that are in the marketplace, or shareholders that are more
Yeah.
diffuse, and they don't have the weapons of the state at their disposal.
And is there something you think a government is supposed to do to protect this? Dus not only from the platforms, but also to teach maybe the people for healthcare or what they need to believe or not?
Well, I think the primary task of governments is to put good information out into the public, and to do so in ways that meets people where they are. Right. So public health agencies, I think, have to do the very careful work about thinking through what are threats to public health, what are the risks involved, So if you take something like COVID, right, it's remarkably complex,
Mm-hmm.
because we also know that certain restrictions and COVID era precautions, such as keeping people home, for instance, also related to economic uncertainty, it related to mental health crises, it
Yeah.
damaged student learning. All these things need to put in balance with one another. So governments are sort of tasked with thinking through these various very difficult trade-offs in consultation with elected officials, who also have to be listening and open to the public and what the public needs. And then once they sort of arrive at a set of arguments for the balancing between risk and safety, for instance, then it's on them to communicate that in ways that are going to meet people where they are, in ways that are going to be transparent about these various trade-offs, about the risks that are involved. I think one thing we know is there are all sorts of communication tactics that can be pursued that are both deliberative, but also that are just honest with people about these various trade-offs and about the uncertainties that come with any sorts of action
Mm-hmm.
in health. And I think that it's incumbent on those agencies, in consultation with elected officials and elected leaders, to be custodians of the public trust and the public interest in how they communicate.
Yeah. And do you think now with the growth of artificial intelligence tools, ChatGPT, is there something they can do or what we can do with them to discover more about it or use as a tool?
Yeah, I mean, I think so. This works, I think, on a few different levels. Like, one is the question of generative AI and information integrity generally, right?
Mm-hmm.
So, and again, this goes back to that sort of the responsibility model, right? The social responsibility model. So, any company that's involved in generating AI tools for public use or for private use, right, have a certain set of responsibility to ensure the integrity of the information that those models are returning.
Mm-hmm.
And that's because it can impact public health, it can impact politics, it can impact democracy, whatever that might be. So that would be one thing. The other thing is that I mean, I personally, I think generative AI is an extraordinary tool that can be used in a variety of different settings. I think thinking about how do we apply those in ways that will strengthen public health outcomes should be part of that social responsibility model as well, whether that means figuring out, well, what is the best or optimal way to sort of message to people about risks involved in certain public health contexts, whether that's designing tools that help people make better choices when it comes to having better information and determining their own courses of action or determining their own risk for certain things that they do, whatever that might look like.
Mm-hmm.
I think those tools can be enrolled in various courses of action that we're all pursuing as human beings.
Yeah. Just take a look. Yeah, I was wondering because nowadays I know as a student you can open Google and ask everything you want, but sometimes I feel it's very different to decide what you're gonna believe. But sometimes what you already said is the platform they make a choice to recommend something. But
Mhm.
for me as a student, I find it very difficult to believe. How do I know what's right or is verified by the government? Or is there any tool for people that they can see um, what to believe or not? Or
Yeah, I wish there was, right? Like, so this is one of the challenges, right? So I mean, the best thing that I would say is sort of like, this is that information literacy set of practices that we all
Mhm.
simply have to learn. We have to be teaching it to our students. We have to be teaching it to our kids, and we all have to be critical consumers of information that we see online. I think within your question, you had the answer, which is you want to triangulate between various sources of information, and you want to look to the processes by which information is produced, right? So
Yes.
we can think about, Google and what gets returned through Gen AI on Google as sort of being like the first touch. But to your
Mm-hmm.
point, like, how can we actually trust it, right? And that's a complex mix between what you already know to be true about the world, and you're constantly weighing new information against your
Mm-hmm.
prior, sort of what you know to be true. But then also, if something doesn't quite sit right with you, or you have questions, then you have to think about, like, what are the institutions that are public knowledge producing institutions that produce information according to some process,
Mm-hmm.
that then have a step towards getting it right, right? And it exists within that process, right? So if I were working with students or my kids on this, I would sort of say, like, information that you find in a newspaper, for instance, comes at the end of an editorial process where there's a group of people tasked with getting something right. And even if you don't know the steps that went into reporting any story, you know that this is an institution that exists in order to
Mm-hmm.
verify information as best as they can within a certain time frame that they need to get it done, right? It doesn't mean that it's perfect, but it does mean that you know that editorial process. And then if you were to sort of scale up, government health agencies are another one, right?
Mm-hmm.
So they exist in order to take lots of data and lots of information and try to produce public facts that we can act on, or they can issue information or recommendations on the basis on. And at the end of the day, that people within that agency aren't just putting anything out as they feel like it, but there's a process by which they're vetting information before it gets made known to the public. Or that a lot go into making recommendations where they think about, what do they know to be true? What do they know to be not true? What do they know to be true with any degree of certainty? How are they vetting recommendations? That that there's a process that exists within that, right? Um, so that's what I would say is test the things that you see on social media or the internet. Test the search results that you're getting back against what that knowledge producing institutions are
Mm-hmm.
also saying. And because we sort of know, scaling up that chain, that there's different levels of editorial processes that are involved in vetting that information, as well as the recommendations that you might be hearing from them.
Yeah. And my last question.
Yeah.
Um, Influencers and social media are often mentioned in false information or disinformation, but is there something they could do to help to raise awareness or to give good information? Because nowadays, I think every student or child is on social media, so they see it a lot.
Yeah. I mean, um, I think this goes back to what we talked about before. Like, to
Mhm.
me, if you're an influencer, you have a responsibility to the people you are influencing, your publics, your audiences, that you're a custodian of that trust. And that means that within that responsibility model, it's incumbent on you ethically to
Mhm.
communicate in ways that are responsible. So that means not putting the people who follow you, who trust in you, who believe in you, at risk of getting sick, putting themselves at risk of getting others sick, right? Whatever that might be. And that if you are influencing people to do certain things, that you're transparent about what your motivations for that influence are, right? So if you're profiting off this in some way, even through advertising, then you have a responsibility to be transparent about that, because it doesn't look like me talking. Like, I have no incentive to talk to you right now. Like,
Mhm.
I'm doing it because I'm an academic and I get paid, because I'm at a public university. I get paid by taxpayers in my state, to produce information that's public interested, right? Like, I'm not making money off this. If I were making money off this and if I had something to gain by telling you particular things in particular ways, I should have the ethical responsibility to disclose that, right?
Yeah.
And I think we need an influencer ethics that places social trust and social responsibility at the heart of what they do.
Mhm.
I think influencing is a great thing. I think there's a reason why people put their trust and faith in this whole new class of people because I think they speak authentically. I think they speak in ways that transcend the genres of public health and even journalism, and that people respond to that. But with that influence comes great responsibility. And I think it's that ethical obligation that we have to get back to.